So what is the best cure today?
Okay.
I know there's a lot of medications, but what's
Yeah.
your go-to?
So that really depends on what these headache logs look like, whether this is a migraine that's chronic and coming in with just variant changes, or if it's an acute sudden onset of a migraine. We ideally look for a multifactorial approach to dealing with the migraine.
Okay.
So what that means is if we're finding a trigger or a response to their migraine, we take it away. Either too much or too little caffeine, either alcohol, either the stress, either the sleep deprivation, medication, supplementations. We look at all that to kind of help in treatment plan. So it's not just one thing, it's looking at everything else that might have triggered and giving them a plan of care. Abortive therapies, which are medicines that you take that should get rid of a migraine relatively quickly, they're various that exist. Typically we start with over-the-counter agents, but if it's severe enough, you've tried over-the-counter agents, you've tried different supplements, we resort to medications that help alleviate some of those vascular changes, alleviate some of the neurological changes, and those are usually triptan, a class of medications that we can start off with abortive therapy. It just depends on the dosage, it depends on the type of patient, it depends on the type of migraine that you're having. In addition to anti-inflammatories and other agents, there's various things we can do, even medicines for heart help control migraines. And when we're dealing with acute sudden onset, we're dealing with two things. Either you're having migraines that are really occurring often enough to not necessarily treat at the time, so it's called abortive therapy, but we look at that as, okay, well, if you're having 4 to 5 migraines in a month, something is not right. Something is not happening the way that it should, and so we look at those external factors. If you really are uncontrolled, then we start prophylactic therapy, prevention of the migraines. And those are a different class of drugs that we start depending on your symptomology. But if you're coming in on an acute day, you're not really feeling any better, it's your first migraine of the month where you've been doing relatively well.
Exactly.
We look at external factors, and there's a handful of drugs we can use in that clinical setting to help abort your pain.